Then about the classification, it depends upon position of the knot. When we say the position of the knot, it means typical hanging or atypical hanging. Then upon the degree of suspension, it may be complete hanging or partial hanging. And when we say as typical hanging, it means that the knot is at the nape of the neck. The rope has been tied such that the knot is at the nape of the neck. This is typical hanging. That the ligature is situated in the midline above the thyroid cartilage, going up and back, and noose or the knot, it is at the back of the neck. So this is the knot at the occiput. This is typical hanging. Midline going up, oblique, backward, and the knot is at the occiput, and there is a lift up because of the weight. That is typical hanging. And in this position, there is maximum possibility of compression. Then atypical, any variation from this typical position. That knot is not at the occiput. It may be on the sides, right side, left side, or on the front. So any variation from typical is atypical. So atypical hanging means any variation from the standard position of the knot at the occiput, that is called atypical. It may be present on the side, it may be present on the front. Then upon the degree of the suspension, complete. Complete hanging means that the feet are not touching to the ground. That means complete hanging. And incomplete or partial, when the feet are touching to the ground. It may be any position, inclining forward, reclining, sitting on the knees, or sitting position or prone position. So partial hanging means when the feet or part of the body is touching to the ground. But even then, the weight will be sufficient to occlude the vasculature or the respiratory passages. And even the weight of the head only, not the whole body, is sufficient to produce the constriction. Sitting, kneeling, prone, or any other posture can cause it.